Good afternoon, class. Can you tell your other classmates that we are going to start in a few minutes? Thank you. Okay, good afternoon once again. And unfortunately, we're doing online today. Um, so let me go ahead and share first my screen. Okay, can you see my screen?
Yes, ma'am.
Okay, thank you. All right, once again, good afternoon. Today we are going to talk about antidotal measures in poisoning and specific antidotes. Now, let us differentiate first what or how or what does the severity of the poisoning could be. So we have here acute poisoning and we have here chronic poisoning. Now, can I ask someone from the group to read the difference between acute and chronic? Any of you? Okay, go ahead.
Acute poisoning, these marked disturbance of function or death within short period of time. Chronic poisoning, progressive deterioration of the functioning tissues.
Okay, so ideally, the difference is already stated in there. Thank you very much for that. So, as what you can see, acute poisoning only differs in a short period of time. However, for the chronic, it is a progressive deterioration. So medyo depending on how or how fast the deterioration is. But as you can see, under chronic, it is quite prolonged depending on, again, how progressive it is. So let us try to see how we can do the management of the poisoning. So as what I've said previously during our lesson, so depending on the intake of the poison and depending on the kind of chemical substance or drug that is being taken, ang ilaang duration. So we have here the primary survey, secondary survey, and the management. Now, what does primary survey state? So we have here under primary survey, we have the initial assessment. So there you can check the airway, the breathing, the probable circulation, disability, and the exposure. So these are the first thing that you are going to do for the assessment, okay? This is applicable in all clinical emergencies for immediate assessment and treatment. So, let's for example, there is a patient that you can see somewhere or along the walkway na nakita ninyo that nobody has gone to that patient immediately kay mahadlok sila. If ever you have kanang you can encounter this kind of scenario even though you do not know what happened yet, as long as dili nimo siya i-move ang patient, then these are the things that you are going to check. And kuha na lang, additional na lang ng crowdsourcing. You're going to ask if kuan grabe na to mga probable kuan bystanders, if they have seen the patient, if what was the previous thing that he or she does. Pwede. However, these are the things that you need to look for. You need to check the airway as usual, even though even gali sa mga seizure patients, bawal mag-put of any thing by the mouth. So you just only need to check it. And for this is out of the context, but for the seizure patient, you need to check na dili wala something inside the mouth. However, on this case, you need to do the head tilting and then the chin lift just to verify if there is something inside the mouth. And after that, you need to check the breathing of the person. Of course, be sensitive because you are also breathing. But pertaining to the patient, you need to listen if the patient is still breathing or if there is a sense of air passing through either way sa iyang nose or sa iyang mouth. And of course, you need to check. I believe everyone knows how to check the heart rate. No, we are sensible on the part of checking the heartbeat of the patient, the areas of it. Does everybody knows where to check the heart rate or the beating area of the patient? Uy, hello.
Yes, ma'am.
Okay, very good. So I don't need to reiterate it. So aside from that, we also need to check if the patient's disability. You need to check for, or you need to speak for the patient if it is responsive. Um, you need to check if the patient is still alert, even though that happens to him. He is still sensible to the surroundings. Need to check for voice responsive, pain responsive, and lastly, if it is not responsive at all. So, you need also to check, labi na og ang patient is balot na balot. Maybe we don't know how or what was the the length of the exposure or how wide is it already. So you need to check it off. For women, of course, we cannot easily remove the clothing. We need also to be kanang particular and specific. So, nagyapon dapat ang pagka-delikadesa. However, in this case of emergency, you should know where to open or remove things out in order for it not to be kanang very puyot to the patient. It should be na siya airway, okay? Or na siya breathable surrounding. So there you go. So these are the things that you need to assess during the approach that you are going to do. So again, through airway, you need to check for the voice, breathe sounds, cough reflex, even the gag reflex. This is the probable procedure that you need to do. Of course, this is only the first thing that you can do, head tilt and chin lift, especially if you don't have the needed equipment or machineries. So you cannot intubate it yet if you don't have any apparatuses needed. So this is the first thing that you need to do. But if you are already a rescuer, if it's such an emergency, you need to know how to do this. And aside from that, under breathing, you need to check on this: chest wall movements, chest percussion, respiratory rate, and yes, you need to be specific on this. We have here 12, 20 for 1 minute, and the lungs auscultation and the pulse oximetry. Oh, let me tell you, or let me ask you rather, how would you know if the patient's breathing is still okay? What would be the minimum rate? So yung oxygen in order to check the pulse oximetry. What is the minimum? But you can assess that the patient is oxygen is still fine. How would you know? Okay, so the good condition or the good state of a patient with a good rate of oxygen, it should be 97% to 100% or 97% and up. That's fine. However, if the patient is having it from 85 to 90, you need to be in an urgent state of that, okay? Okay, possibly it could still drop. So, even gali ang 95, medyo okay pa ang 95. However, if mubaba na siya 95% below, you need to take note of that, okay? So, in checking on this, you need, of course, if the patient is lying, you don't need the patient to move because you don't still know if that is a particular for poisoning or other incident. okay, basin din na siya spinal kanang na-distract ang spinal, could be under the thoracic, the lumbar, either way. So we cannot just move it easily. So if you have, if you know, if the patient is rather having a kanang hard breathing, so you need to know the possible treatment, okay? So if you have sometimes katong, if we don't have bag mask ventilation, if you have the rescue CPR nga katong mura siya o kanang cellophane but it's not cellophane. If you have that, then you can use it. But again, this is just for the assessment yet. So yan lang tayong mga emergency nga mga procedures kinabuhat. Just to cover up nga dili ma-loss ang patient on the spot. So aside from that, we have the circulation. So as stated earlier, we should check if the skin color of the patient is changing, of course. If it's turning to violet, well, that is kind of a warning or alarming effect from the patient. So if the patient is sweating hardly, so you need also to check on that. And then you have for the capillary refill time, this has to be done if the patient is quite, if the rescuer is already an expert. Aside from that, the palpitation rate or the pulse rate, so you also need to check it together with the oximeter. So we have there your heart auscultation and your blood pressure. And then by the way, this one needs an equipment, so we can totally perform this immediately. But these are the things that you need to check on. If there are possible ones, check on it if can be stopped at the moment. If not, again, call the nearest rescuers or ER. So there you go. We also have to check the disability. So you need to check the level of consciousness, if the patient again is still responsive or not, and the limb movements. So particularly if person is not totally kind of affected, limbs and spinal, they want to try to move, even though it's very hard for them to do so. So, na yung mga senyales na yung So, aside from that, you have to check the pupillary light reflexes and the blood glucose. But for the blood glucose, you need also an apparatus for this. Okay? So, there you go. Para believe ko sa kanang uban bitaw nga mga, especially you or the nursing students or even the other allied health nga mga students, some of them used to bring katong glucometer. Some of them used to bring oximeter. And some of them also used to have katong bitang kanang pulse rate counter. So, but sometimes pulse rate is counter is done manually. So, ingana siya usually. So, aside from that is the exposure to skin temperature. So you need to also check on that. What could be the probable cause? So that is how your ABCDE approach needs to be done. So and that is for the initial assessment. Let's go and check the secondary survey. So we need to check the history and the physical exam. So in this case, the focus of the history and physical exam includes a physical examination that focuses on a specific injury or a medical complaint, or it may be a rapid examination of the entire body. So in this case, the patient has already gone to the ER or to the doctor's clinic. So these are the things that you need to check in history taking. Of course, the signs and symptoms of the patient after being rescued, possible allergies that is going to manifest, the medications, the previous medications that the patient is taking. And oh, by the way, if the patient has already list of allergies, you can also check on this. And then the pertinent past medical history. I know that here in the Philippines, but I believe though we don't have HIPAA, just like from the other country, we are still, conveying the confidentiality of the records of the patient. So if you are going to have it, I think you can request for the past medical history, but I believe these are been done by our physicians. So aside from that, last oral intake of the patient, and then the events leading to the illness or injury, or the probable cause of the illness or injury. So there you go. These are some of the physical examinations that we can or the patient can have. So we need to check the vital signs. So again, I believe we know how to do the temperature if we are going to ask. If we are about to ask by our kanang mag-rescue. So na natin mga initial. Okay? We have the heart rate, the pulse. So these are the minimum, ha. 60 to 99 beats per minute. Same goes with your pulse. And for your blood pressure, 120 over 80. However, actually, mo ni siya ang kasagaran na nato mabawaan nga ay ang minimum state or ay ang good condition state sa kuan blood pressure result. However, sa iyag yung exact nga kuan kanang result for your BP, depending siya on your weight, depending on your age. So mura siya BMI type. But for everybody's knowledge, it is 120 over 80. So there you go. Aside from that, we have the respiratory rate, the breaths per minute, oxygen saturation, and then the pH. So aside from that, we have dermatological signs. So ideally, makita ninyo siya physically sa patient. If there is something that needs to be taken note, especially it is being seen outside. And then for your gastrointestinal signs, what could be the probable signs for this? Sa gastrointestinal that you can try to check. So possibly, if the patient is bloated, isa na sa factor. Of course, you cannot, if let's say the patient is still not yet responsive, you cannot, of course, check if the patient is constipated or not. However, the things that you can check is that if the patient is bloated, or if may mga cases nga kanang, let's say for example that the patient is kanang responsive in a way nga dili pag yun fully responsive. So initially lang, pwede ninyo siya i-try o check ang iyang abdomen. If the patient is responsive, if inyo siya i-press on, masakitan siya, then that is also a sign. However, the rest of the signs that could be undergone through your gastrointestinal could be the change in bowel habits. If kuan na, pwede na inyo mastery ang patient. Or if the patient is constipated or experiencing diarrhea, and if there are incomplete bowel movements, you can check on that. And the narrow stools. So sometimes rectal bleeding is also asked. So aside from that, we also have the toxicodromes. So these are some of the things that you need to check on. So let's see. Okay. For your cholinergic, usually this represents the acute phase of your cholinesterase inhibitor poisoning. Now, it results from the accumulation of excessive levels of your acetylcholine in the synapses, glands, smooth muscles, and motor end plates, where your receptors are found. So that is under your cholinergic. And for your anticholinergic, so this is on the other hand of the cholinergic. So this one results from the competitiveness of the antagonism of acetylcholine at central and peripheral muscarinic receptors. So it differs from the receptors that they are going to find. Okay. And then, usually, if in any cases, the central inhibition leads to an agitated delirium or typically nanay mga confusions ng mga hitabo sa patient, restlessness, and picking at imaginary objects. So, muna siya usually ang ang characteristics under the anticholinergic. And also, aside from that, you also got your opioid. So, we all know opioid is under the control substances or the S drugs. The S1, S2, S3. So, ano siya. So, under po sa inyo ang opioid, you can check on the patient if the patient is having pinpoint pupils, respiratory depression, and probably they also manifest decreased of level of consciousness. So usually, kani siya ang tolo, these are what you call the opioid overdose payan. Muna siya pinpoint pupils, respiratory depression, and decreased level of consciousness. So we also have the sympathomimetic toxicodrome. So these also differs depending on its result. Under this one, this is a combination of physical findings characteristic of overdose of certain classes of drugs. This includes your cocaine and amphetamines. So, dili siya diretso ma-perceive. However, since these are combination of kanang findings, physical findings, characteristics. Mainly, if dili ninyo siya makita sa cholinergic, anticholinergic, and opioid, definitely you can check on the sympathomimetic since it is a combination. Aside from that, we also have your sedative, sedative and hypnotic toxicodrome. This one is more more popular. So, usually, kini siya nga toxicodrome under your sedative hypnotic. Usually, visible na siya sa patients with anxiety, agitation, delirium, usay gali mga tachycardia, mga patients experiencing severe tachycardia, hypothermia, pwede po. Kasagara po ng mga medications under sedative hypnotic as quoted there, your sedative hypnotic drugs could be your propion, and then bupropion, and then I think that was, if I'm not mistaken, the venlafaxine. Have you heard of that medication? The particles of it can precipitate seizures when ingested at toxic level. So, monang ginayon na to nga, those drugs that are being prescribed, if not taken under recommended dose, they can really manifest toxic effect, probable toxic effect. So these are the things that you need to consider. So aside from that, we already gone through your initial assessment and your history and physical exam under your primary and then your secondary. So we have to check and we have to have the knowledge under how to manage this kind of effects. So we have already checked on the history. We need to have the diagnosis of the patient and the possible therapeutic management that we can give. Okay, so we have here the circumstantial evidences. This differs from the event and site of poisoning. So you need to check if the patient is exposed to that certain area. Um, Probably you need to, especially those rescuers, they need to check if the place is has the possible exposure of a specific chemical substances if it is not taken orally by the patient. Aside from that, we have the postmortem. It is the substances or drugs that is gathered after an autopsy is performed. So, dili ra siya kay probably the patient is taking a lot before the incident happened. So, the person who needs to check for the autopsy of the patient needs to collect those specific substances. So I believe it won't differ from only one substances, especially if the patient is also taking drugs. So they need to check what specific or particular substance has intoxicated the patient. So aside from that, we have the experimental evidences. This is under the observation of signs and symptoms to animal subjects. Aside from that, we have chemical evidences, which is acquired by extracting blood in the body fluids from the patients and tested with specific reagents. So, if the patient, let's for example, is undergoing edema, so naibang possible um, cases nga dili siya on the spot makuhaan og dugo for that cases kay dili malocate ang blood. So we have another preferences to check, and that is probable body fluids that the medtechs could get. So aside from that, we also have the symptomatic evidences, comparison of established signs and symptoms with that of the patient. So later on, you would know what are the probable symptomatic manifestation of a patient having or being intoxicated. Okay, so there you go. We have here the evidence of poisoning and chemicals. So we have the specific test and then the poison or the substances that could be detected under it and the probable result. So under the AAS, so we have since we have a lot of heavy metals, the result depends on that specific area of metal. However, for your Bilstein, the halogens, let's go back to chemistry. So what are your halogens? What are the elements under your halogens? Uy. If you remember the mnemonics, fresh, clean breath. You still need to you still need to familiarize those because it's, helpful. So yeah, your fluorine, chlorine, fresh, clean breath, bromine, iodine, astatine, tennessine. So those are your halogens. So through this test, you can come up with a result of green flame. So aside from that, we also have the benzoyl gunning, the acetone, and then the result is your indie protein. And aside from that, you also have your bromine water, your aniline. It decreases flesh color. So you can just take note of the evidence of poisoning here. So we also have your brown ring for your nitrite and nitrate substances. Well, of course, it produces rings. Even in the chemistry side, it shows rings also. The Daven's iodoform, it checks your methanol and your ethanol. The result is that it decreases a yellow color. And aside from that, we also have the Marquis test. These are the common drugs of abuse. So what do you think are the common drugs of abuse? Can any of you give an example of the common drugs of abuse? So let's say here in the
Opioid
Philippines.
analgesic.
What was that again?
Opioids, ma'am.
Yes, exactly. And one of which also is your, I believe it is still kanang maybe not number one, but naagyapan siya sa top list. Inyo ang methamphetamine hydrochloride, or you're also known as shabu. So I think it's still on the top of the list under the Philippines drugs abused. So yes, I guess so. It's still on the list. So aside from that, by the way, these are the probable results. Okay, so you need to check on the indication of this. So it differs depending on the drugs, since our drugs has its own families, since it has its own categories, so it depends. So lastly, we have here the Marsh test to check the arsenic. Before arsenic, even now, but there was a a time or a season that arsenic poisoning is very rampant. So mauna siya nga during those time, it is really prohibited labi na sa mga minors. No, a lot of people nangamatay during that time. So kuha na siya from time to time, gina-check na siya. So aside from that, we still have here the continuous list. So by the way, I'll be giving you the PowerPoint later on if we are already done. So you also have here your modified docinoids, the marijuana, the very well-known Mary Jane. So there you go. To kindly familiarize this one. And aside from that, we also have evidence of poisoning under symptomatic. So let's, for example, so we have here the possible odor and the substance, sorry, and the substance that pertains to it. Hold on, Taha. Okay, so we have here your nitrobenzene. The odor of it is like shoe polish. And then the ethanol, the fruity odor, of course. And for the arsenic, malathion, phosphorus, and thallium, you have the garlic odor. Basin ha, na mag-ingon sa inyo nga na-poison niya, without asking the history of the patient, nagkaon na rin daw siya o kanang, sige, Bisaya sa garlic. Basta garlic.
Uy, bawang.
Oo, nagkaon na siya. Kaya no, you need also to ask the person in order for us also to have the good ethics that we have. So, yeah. Aside from that, yes, these are the other list. You have there your cyanide, your acetone, your chloral hydrate, your hydrogen, the naphthalene, so on and so forth. So these are the possible odor if you're going to check it based on its symptom using the order of the probable patient. So there you go. So aside from that, we also have the skin discoloration. Well, aside from stating the probable history of the patient, so you can distinguish already, through this. So you have your boric acid, the boiled lobster appearance. I should have a picture, so that you can appreciate what could be the possible physical look good and a boiled lobster appearance. But yeah, you can check it on your own. So you also have your phenol for it shows bleaching white, but actually dili siya totally kind of whole body. There is only is pertaining or certain area. Same goes with your sulfuric acid, iodine, silver nitrate. So kindly familiarize this one if you can memorize and well good. Okay, I will not go through that. And aside from that, we also have the vomitus, or yes, the probable nga color sa suka. So yes, isa may dililod anon dire. You can, because you can really also check on that, because whatever you intake, probably that is also the thing that you are going to someone vomit. Okay, so if there are copper intoxication, probably one of the area that, or suka nga magawa sa the patient, it would be in color of blue green. For sulfuric acid, ground coffee. Ma'am, dubi ko nag-inom raman siya uka ng kape. Again, you can identify it also by asking the patient, and this is only the confirmatories, probable confirmatory results. So you also have your phosphorus and arsenic through luminous vomit, and then your chromium under yellow green. So there are also cases that we can check under the discoloration of gums. So if you can, if you're really quite observant, maklaro ninyo siya even if not asking the patient kay kanang katawa or mga yan ang cases which is visible ang gum sa patient. So, but these are the probable colors. The blue line gum, the black line gum. So, we have here bismuth and the lead for blue line, and then mercury arsenic for the black line gum. So, there are a lot of cases that you need to check, kay sometimes they do not, the probable symptomatic evidences is not just kanang magawas ni tanan. So probably you have only choices na pwede ninyo ma-check on siya. It could be under the odor, the skin discoloration, the vomitus, or the thing that the patient has vomited, and then the discoloration of gums. Aside from that, we also can check the respiratory changes of the patient. So you have in there for Veratrin. Are you familiar with Veratrin? Hello, are you familiar with the Veratrin? Ala, you need to go back checking on the medications, chemical substances. However, your Veratrin is used for rheumatism, or sometimes can be used sa neuralgia ninyo or to the patient. So, yeah, you can check the violent sneezing. Dabi may ngon siya lang nga, Ma'am, basig kuan ma'am, agi ra sa kanang rhinitis ma'am nga nikaging. Okay, then again, you need still to check the patient's history. So you cannot just come up without asking. Okay, lang hold on. Okay, so aside from that, you can also check the sulfur dioxide, probable irritation in the breathing of the patient, carbon monoxide, this okay, going back, carbon monoxide for the dyspnea, and then the opium, the barbiturates, benzodiazepine, and the cyanide for the general respiratory depression. If you know how to use the hello, can you hear me? Hello.
Yes, ma'am.
Okay. Hindi ko nino kumawala or what ha. Anyway, going back, so if you know how to use your step, you can easily hear it. Okay? Aside from that, we have also in blood changes. So, if someone is going to check, actually ma-check niyo siya if there is a blood extraction, even though dili pa siya dayon ma-separate, you can check it on the extracted blood nga naa pa sa ilaang kanang syringe or nasa ilang kanang gamay nga murag vial nila. So, you can check if there are if the patient's blood is on cherry red, dark red, and chocolate blood. So there are certain pertaining chemical substances that could be identified in it. So aside from that, you also have bowel changes. So isa po, if you cannot check it via the vomitus, you can check it through the bowel. Pero kung dili gyud makaya, well, we can, these are by the way, possible lang, pwede na, again nato ma-check ha. So, if you can check the stool is color black, could be, one of the leading cause could be the iron, but there are also a couple of substances that could be the reason anong inga na result sa ilang stool. So there are also like clay-like. So sige pilian lang ninyo kung sa kasagara ang color sa inyo ang kuan kanang stool. So probably these are the reason behind it. Okay? If you can see, there is an iron under the green color. This is just rare, but most of the time it's under color black. Okay? Sige, I will not ask na lang, but I just want to let you check, self-check lang siguro or within the relatives. If is there any cases that most of the people nga within sa household na moingon nga hala kanang nagdugo lagi ang ako naalagi sabay nga dugo ang ako ang stool. So that was the first case. Pagka next dayon kay hala kanang nahimo na lagi itom. Okay, there are cases nga mo accumulate na ang blood sa inyo ang stool, that is why it sums up with a color black, but actually there is already blood in it, so dili lang siya kanang iron itself. But yeah, there are a lot of things mo bitaw ng if you have gone through a stool exam, dili gyud mo sugot ang taga laboratory as much as you can kay well known naman ni nga scenario. Ginapalit lang ang, I'm so sorry to use the word, tae sa gawas. It's not their own quantage stool, ginapalit lang nila sa gawas. Well, that is not healthy. So if there are cases nga you are being required to some or certain kanang mga requirements that need stool, if you can make it on your own, do it on your own. Okay, probably you'll get to be exposed with wala to kabalo ka sa gipalit ang certain stool. So, by the way, ano niyapot matadara. So, yan na siya. So, these are the possible bowel changes. So, if there are bowel changes or stool color, to be identified, we also have the urinary changes. So under this one, you need to get to identify also the color of the urine. If it is under dark yellow, probably there is a picric acid. If there is a yellow brown, it could be the aloe or senna. Ma'am, di ba safe naman na siya? Okay. There are, same goes with the other substances. There is a way of intaking of this possible substances such as your aloe. Actually, this is a traditional plant. So, na siya certain way nga pwede nga pagkahimo nga pwede niyo siya ma-intake. But if it is directly from the plant and then diretso ra ninyo intake, no, it's not that. Because it can be contaminated because it was just nag-grow siya outside, so susceptible siya from different substances, intoxication. So let me tell you, it's not that kanang, it's not recommended nga kung makakita mo. Bitan lang even ang ato ang mga plants nga for food, they need to be washed thoroughly if it is not kanang nakakural or if it is not guarded. It needs to be washed thoroughly. Okay, probable there are chemicals nga ni tapot sa iya. So it could contaminate the specific plant. So probably, if you, the person who is going to eat it, na wala ninyo siya gitarong o wala proper handling, so you are susceptible for that toxic effect also. So aside from that, we also have here other violets, the turpentine, phenols, methylene blue, under green blue, and then the rest. This includes one of your antibiotics for your TB, the rifampicin. So there you go. Aside from that, the most common also evidence, we have here the visual disturbances. So we have here purple vision. Wala ni sila naka-contact lens ha. But it can really ma-check on ninyo siya if the person is kahit kanang magreklamo. So there are probably purple vision for marijuana and digitalis intakes, and then blurred vision for anticholinergics, methanol, formic acid, solanine under partial or total blindness. So if there are specific nga mga kanang reklamo ang patient, then take note of it, especially if it is already with regards to the patient's vision. Actually, you need to take all whatever the patient is kanang ireklamo nila. Could be under the odor, under the color of the stool, and even the visual or the vision that they got. So also, one of your ripes, the ethambutol. And then, okay. Actually, among purple vision and bloodshot eyes, ang pinaka-common nga visual disturbances gid sa marijuana ang bloodshot eyes. So, ideally, to follow lang din ang purple vision. So these are some of the other changes that cannot be categorized, but they are manifesting in result of being intoxicated of the specific substances. So nanabay naka-experience sa inyo ato nga mga evidence of poisoning, mga symptomatic evidence? I hope wala. Ha. So these are some of the other changes. Okay. I'll give you a quiz this coming Wednesday. And then we will continue to tackle about therapeutic management. So for today, or for this coming Wednesday's quiz, it will be all about the acute poisoning towards the last part of the evidence of poisoning under symptomatic. So, do you have any question, clarification? Wala? Okay, so I guess you are all ready for the quizzes coming Wednesday, and then we will just continue again under this therapeutic management. So we have ended under diagnosis sa inyo ang management. Okay? Ah. Nga naman, ganahan mo mag-group quiz. Wala may nito mag. So, dili pa mag-group quiz. It would be individual. It would be individual quiz. Any question? Clarification. Violent reaction. Wala na? Okay, so I guess there is no further question. For those that needs any consultation with regards to the research, I think I'll be at school tomorrow and then I think on Wednesday. Okay? So I think that would be all. Thank you very much and see you on Wednesday. Bye.
Thank you, ma'am.
Bye, Mom. Thank you.
Bye.
Bye.
Thank you, ma'am.